Welcome to the Royal Free Hampstead NHS Trust. This information video will give you an idea of what you can expect when having cataract surgery. Over 300,000 cataract operations are carried out in England each year. Consultant ophthalmic surgeons and their teams are seeing more patients every year. A cataract is a clouding of the lens in your eye, and a large number of people over the age of 60 have some problems with their vision because of cataracts. Early signs can be when you have difficulty recognizing people at a distance, or difficulty in reading, or when you see glare from sunshine and car headlights. Certain types of cataract can also affect how you see colour. They create a yellow filter which knocks out the blue from your sight, so colours are not as clear and sharp.
I never really thought there was much wrong with my sight, but then 2 years ago I experienced what a miracle feels like. I had my first cataract operation, and afterwards I could see so clearly, and I noticed the sky with its extraordinary delicate blue color. After seeing the beautiful colors of nature, all I could say was wow. I want to say to anyone having trouble with their eyes, please don't be afraid to have the operation, as it changes your life for better. You become more confident, more independent, more secure, and less fearful of accidents. You are in control of your life again.
Following a referral by your GP or optician, you'll be sent an ophthalmic outpatient clinic appointment, and most patients will go to the local hospital of their choice: the Royal Free Hospital, Barnet, Edgware, or the Whittington. You will first of all be seen by the nursing staff, who will carry out some simple eye tests, a distance reading test to record your distance vision, and an examination of your pupil to see how it reacts to light. You will also have some drops put into your eye, so your vision may become slightly blurred. The doctor will see you, and you will have some further examinations. When all the tests have been completed and your diagnosis confirmed, the doctor will go through the results, discuss your condition with you, and tell you about the options that are available.
Well, there's certainly a significant degree of cataract, and I would have thought you're just the sort of patient who would do well from cataract surgery.
What exactly is cataract surgery?
If we look at the model, we make a very small incision in the edge of the cornea, the clear window of the eye, that measures about 2.5 millimetres. And it's self-sealing, so it doesn't leak afterwards. And the lens sits behind the clear window and behind the iris. We remove that lens and replace it with a clear plastic lens that sits in precisely the same position.
Usually that lens requires no further attention. The risks of surgery are very low.
And what are the risks?
Well, if you take a group of patients as a whole, if you take 100 patients, 95% will get an improvement in vision.
Oh, well, that's reassuring.
2 or 3% there'll be little change one way or the other, and about 2% will have an actual drop in.
The doctor will also explain to you that there are sometimes complications following the surgery. About 1 in 20 patients have minor problems, like soreness or swelling after their surgery, and about 1 in 100 patients do have more serious problems, like glaucoma or retinal detachment. If you decide to go ahead with cataract surgery, you'll be asked to give consent, and we will book you in for the operation. A letter will then be sent to you within a few days, informing you of your proposed admission date. There is a great deal of information available for you to take home, so you can discuss the surgery with your family and friends. Many patients have cataracts in both eyes. It's not usual to operate on both eyes at the same time. Once you've agreed to have surgery, you'll need to be assessed for your medical fitness for the operation. This assessment will be carried out either on the same day as you see the consultant or shortly afterwards, and you'll need to bring with you your current glasses, a list of all the medications you're currently taking, and your contact numbers. The nurse will carry out some eye tests to determine which strength implant is to be put into your eye during the surgery, as implants, like glasses, come in different strengths. You may have some other tests done. For example, if you're diabetic, we'll check your blood sugar level. We only report the results of any tests to you if any treatment or further investigation is required. Cataract surgery rarely requires an overnight stay in the hospital and is carried out at one of the day surgery units. Information on the time you arrive for your surgery and what to bring with you is in the letter that's sent out to you with your admission date. From the reception, you'll go to the unit's waiting area, where one of the surgical team will go through your notes and ensure that all your details are correct. You may be asked to change into a theatre gown, and more drops may be put into your eye if they're required. You may have a further eye examination before the surgery. The doctor will look at the results of the tests and will discuss with you the implant best suited for your eyes. When you are happy with everything that's been discussed, you'll be asked to sign the consent form. A mark will be drawn on your forehead to clearly identify the eye to be operated on, and dilating drops will be put into your eye. At all the hospitals in the group, different equipment is used for you to lie on for your surgery. At Barnet Hospital they have a fully adjustable chair, and at the Royal Free and Edgware hospitals they use a specifically designed trolley. Both of these pieces of equipment ensure that you're as comfortable as possible and able to lie still for the procedure, which usually lasts about 30 minutes. When it's time for your operation, one of the nurses will take you to the anaesthetic room and your details will again be checked. You'll be given a local anaesthetic by the surgeon in order to numb the area around your eye so you won't feel any pain during the procedure, though you may still be aware of touch. A peg is put on your finger which is linked to a machine monitoring your pulse rate, and you may be attached to an ECG machine to monitor your heart. This way we can see how you're feeling throughout the procedure. Before the operation can begin, there's a final safety briefing in the theatre with the whole team present. This double checks that all your details are correct, your operation site is clearly marked, your hospital number is correct, and that the board is written up with your correct name, eye to be operated on, and the size of implant to be used. Only when all these final checks have been completed will your operation take place. Preparing you for the operation includes cleaning